Hello everybody, I am Dr. Meenakshi, and in this video we will be discussing the new TOG article which has been released in 2023, and the topic is vulval disorders in pediatric and the adolescent group. So this is an extremely important topic and it's also quite lengthy, so therefore we'll be covering it in multiple parts. So firstly, whenever we see that it accounts for about 50% of the complaints in the OPD. So in the pediatric age group, why are these vulval disorders very common? It is because of the hypoestrogenic phase in the pediatric group and also because of the neutral pH, making them more liable to have any kind of conditions. And also in the adolescents, some of the important risk factors are like because of any sexually shared infections or because of poor hygienic measures, they are more prone to have these vulval infections or disorders. And in the infections, the most common organisms includes group A streptococcus or the Escherichia coli. So we see that about 20% of the referrals to the secondary care is because of the vulval complaints in the pediatric and in the adolescent age group. And about 80% of them, it is non-infectious, which includes dermatosis, etc. So the most common, what we suspect when they come with the vulval disorders, the most common is the vulvovaginitis. So whenever you take a history, it is very important that you start taking the complaints as in whether they have any kind of pain, any burning, any itching, any kind of vaginal discharge, or have they used any kind of treatment before? Is there any history of atopy or any kind of allergies? And also we need to ask regarding the personal hygienic measures, etc. And always whenever we want to examine the child, whether it's a pediatric or whether you want to examine any kind of adolescent girl, so it is important that you take a verbal consent. And at any point they are free to interfere, and if they say us to stop, we can stop. So this verbal consent is valid in that way. And also whenever they come with repeated complaints, if they're repeatedly complaining of burning, itching or vaginal discharge, it is important that we suspect the child sexual abuse as well. So evaluating in terms of that field is also very, very important. So whenever you examine, you can either lay the child supine on the mother's lap or any caregiver's lap, or putting in a frog leg position or in any chest position also is very, very important. These positions can be adapted. Okay. So the next, whenever they complain of these symptoms, whenever you examine, the consent is also done, and after examining, all the findings needs to be noted down. So in this age group particularly, the most common is because of the personal hygienic measures only. So we ask them to avoid any kind of detergents or avoid any kind of soaps, any kind of harsh soaps usage in that particular area. And always it is important that they wash from front to back rather than back to front, because of the close proximity between the anal canal and the vagina, which can result in the cross infections. So always washing from front to back is important. And also because it could be because of usage of excessive detergents in washing any kind of the clothes. So wearing cotton as well as which are very free, and avoid tight fitting clothes or avoid tight fitting leggings is also important. These are some of the general measures which we can recommend. And also we can give some kind of nappy creams which are like zinc based, which helps in reducing any kind of irritation, and in case any infection is suspected, broad spectrum antibiotics can be used. So the part 2, which covers the rest of the conditions of the vulval disorders like lichen sclerosis, etc., would be covered up in the next upcoming video. I will see you all there. Bye.